Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today is the last episode of 2024, so I thought I would take a little bit of a moment to do a wrap up of 2024, and let's talk about kind of some of the things that we've covered. So while I've taken more of a focus toward TBI this year, we've still had a lot of different topics, a wide variety of topics covered in 2024, including Lewy body dementia, functional neurological disorder, autism, grief, chronic pain, obstructive sleep apnea, diversity and unity, therapeutic art, trauma recovery, nutrition, informed movement, insomnia, pituitary tumor, PTSD, headaches, being the CEO of your own health, masculinity, planning for the future, ketamine-assisted therapy, alcohol, sugar, brain mapping, mindfulness, minerals, accountability, ADHD, healthcare leadership, AIP, pro-resilience, breathing, the most recent conscious medicine, and all of the TBI topics that we had there in between. So if you heard a topic that you don't remember listening to, please go back and listen because I've had some really great guests on this year. I've had a lot of solo episodes talking about concussion things, such as my ABCs of Concussion series that I've started. It's just been a really great year with a lot of really great topics. 2023 was great. End of 22 was also great. We've had a lot of episodes. Today's episode 114. I cannot believe that I've gotten to 114 episodes, but it's so very exciting. So of everything that we talked about in 2024, what have been your favorites? I'd love to hear it. What would you like to hear more about? Please leave me a comment or a message directly. Do you know someone that I should have on my show? If so, please, again, either connect us or message me with the recommendations so that I can reach out to those people and try to get them on the show as well to cover the topics that you would like to hear. So it truly has been a gift for me. So we're in the holiday season, but this has been a gift for me to get back into doing this podcast after my after my accident, excuse me. I know you all didn't really see much of a difference because it seemed pretty seamless at the time. But as a reminder, or maybe just letting you know, maybe you didn't know, I had 6 months of interviews recorded and ready to release when my accident happened. I had them all ready in preparation for transitioning to my new job so that I could focus on my orientation. But as it turned out, I needed them for a completely different reason. That is entirely why you didn't notice a gap. By the time my pre-recorded episodes were exhausted, I was starting the therapies that finally changed my recovery timeline, and I was able to get back into my podcasting. And in the absence of getting back to practicing as an NP as of yet, this is the next most fulfilling thing that I could do. So I'm really grateful to be here. I'm grateful that you're all here as well with me, and I would love to see the numbers continue to rise. So please share the show with your friends, your family, or anyone you think might benefit from hearing what we talk about week after week. Leave me a review, please, on whatever platform you listen to so that others can find me easier. The more reviews, the more positive reviews you have, the more it will show up on feeds as suggestions for other people. So please help kind of boost the podcast that way if you are a regular listener and you love what you hear. Well, I've always said that if I help one person, it's worth what I do. There are so many other people that I would like to help, and I think so many more people would benefit from hearing what we talk about on a regular basis. So again, please, if you could share, leave a review, do what you can to help support the podcast. It's free for you to do all those things. So please help me out if you're able. And with that wrap up completed, I'd like to offer you the last topic of 2024. We're going to cover concussion mimics. So I have talked to so many people lately that are dealing with post-concussive symptoms and they don't even realize it. Why? Because their diagnosis is missed or they have been misdiagnosed. First, I want to cover a few common misconceptions about concussion and TBI. And some of these have been covered in other episodes, but I want to put them all together into one so we can kind of talk about this thing. So the first misconception is that if you didn't hit your head, you don't have a concussion or a TBI. This is untrue. You don't actually have to hit your head in order to have a concussion. The injury happens because of what we call coup and counter coup injury. Your brain is literally forcefully shaken inside of your skull from one direction to the other. So it's another way to think of it, it's in the direction of the force of movement and away from it. So think of an example when you think of when you have to slam on your brakes suddenly in traffic. Somebody stops in front of you, something runs out in front of you, you slam on your brakes. If you have any objects in your passenger seat, they go flying to the floorboard of your car. Those objects weren't hit, but the force of your braking caused them to continue moving in the path that you were moving in, that they would have gone while your car actually either came to a sudden stop or just slowed very quickly in order for you to brake for whatever happened in front of you. That same mechanism is happening in your brain. So an example of what's actually happening in your brain. Think of cheerleaders. If you've ever been to a sporting event and you watch the cheerleaders, or you've watched a cheerleading competition, they have these competitions where you can go and watch them do all these massive stunts. So say one of the girls is thrown up into the air by her squad and she goes way up into the air because they've got this fascinating movement. They just throw her way up in the air and then they have to catch her. So say they catch her, she's caught by her squad, she didn't hit the ground, but you sometimes see their head kind of jerk a little bit when they get caught. That object in motion, the girl's brain, was staying in motion and trying to stay on that same trajectory. And that's when you can end up with a concussion. So cheerleaders, without hitting their head, they're not in the sport that they're cheerleading. They're cheerleading on the sidelines. They can still get a concussion because of the rapid movement of their head inside of their skull. Inside your skull, you have these little finger-like projections. They're bony projections that if your head sloshes back and forth in there, it's going to hit those little projections and it's going to cause damage to your brain, regardless of whether or not you hit anything. The next misconception, if you didn't lose consciousness, you don't have a concussion or a TBI. This is also untrue. Only about 10% of individuals that experience a concussion will lose consciousness. And this percentage actually might be too high, considering that so many people who don't lose consciousness don't even realize they have a concussion. So they're not considered in those calculations of how many people actually lose consciousness. Most people that have a concussion maintain their consciousness. They might say they saw stars or they got their bell rung. Those terminology, those things are actually still other words for I got a concussion. So when you see stars, when you have your bell rung, that's still a concussion. You didn't have to lose consciousness for it. You didn't have to hit your head for it. You don't have to have long-term consequences. Some people are pretty mild, or maybe you don't have the symptoms right away and they show up later. That's to be talked about coming up in this episode still. Misconception number 3. If you have a head bleed, you didn't have a concussion. You just have a head bleed. This is one that drove me nuts when I was doing consults in the hospital all the time. We would get consulted on patients who fell and had head bleeds because they had, quote, unexplained neurological symptoms. Newsflash for you, if you hit your head hard enough to cause a bleed, you also have a concussion. I had so many conversations with people describing that this is why they have their neurological symptoms. So we need to correct that terminology in order to get the appropriate care. So as I did all this education with our patients, we talked about what it means to have a concussion and what kind of restrictions they might have for a few days to let their brains recover from this, because it wasn't just a bleed. Now, some people will consider bleed severe and some people wouldn't, but when you have bleeding on your brain, that is considered a severe TBI. So we should use the terminology and call it a TBI, call it a concussion, so that people get the care that they need, because they're going to need therapies when they leave the hospital. They're going to need follow-up appointments, not just to make sure that that blood cleared out of the brain, but to monitor their symptoms and make sure they're getting the treatment that they need so that they don't have long-term consequences. What are those long-term consequences? We'll talk about that coming up in this episode yet too. So hang on there. Last kind of misconception a little bit. In our healthcare courses, whether it be physician training or advanced practice provider training, we are generally taught that you need to monitor TBI patients, concussion patients, initially for complications, but that after a short time, if they're fine, they're out of the woods. There is so much research to the contrary, though, and I can speak to it from personal experience that symptoms are not always present immediately. They can be delayed by days, weeks, months, or even years. You can literally have years go by without really noticing any symptoms. And then when you do finally have those symptoms, you don't get the answers as to why, because it's not attached to that injury anymore. You don't think of it, and then your provider tends not to think of it. You might not even tell your provider that you had it happen. I did a test on a client the other day who he didn't initially tell me that he had a brain injury. And then we talked more about his history. And sure enough, he did have a brain injury. And a few years later is when all of his symptoms started. He was attributing it to other things and not to the brain injury, when I truly believe it was the brain injury that started it all. And his symptoms wouldn't have bad had he not been exposed to these other things. But also the exposure symptoms wouldn't have been as bad if he hadn't had the concussion to begin with. So it's really important that we get these diagnoses and that we know what we're treating and that we know what we're dealing with, because treatment will help you get better. So if it's not called a concussion at that point or a TBI, what might it be called? What might you get diagnosed with? These are all things that you can find as a potential mimic for a concussion. Stress. Yep, stress. Stress can cause symptoms. We don't often think about what it does to our body, but stress, that emotional stress, has a physical response in our body and it presents with symptoms. And it can cause headache, it can cause fatigue, it can cause difficulty sleeping, all the things that we see with a concussion. So therefore, if you don't attribute it to that injury, your physician, your provider might tell you that you have stress and you have to deal with it. You need to do some meditation, whatever, deal with your stress, and you don't get treated for your concussion. So first mimic, stress. ADHD. We've talked about this as a potential outcome after a head injury, but if you have that ADHD develop, was it potentially because of the head injury? So that's something we need to talk about as well. Depression, chronic fatigue syndrome, chronic pain syndrome. As I've gone through the ABCs of concussion, we've talked about some of these different things, and we will continue to talk about these different things in upcoming ABC episodes. All of these things have kind of overlapping symptoms. They could be this, but they could also be concussion. So we need to think about that timeline. Anxiety, migraine, TMJ. TMJ causes headaches. It can cause the same kind of a headache that you see post-concussion. Occipital neuritis. Again, it's a headache, back part of your brain. Where did you hit your head? Could be concussion related. Intoxication. This one I saw actually too in the hospital when patients would come in with stroke symptoms, which is also a brain injury. It's an acquired brain injury. So when you have a stroke, that doesn't mean you can't also have been drinking alcohol. It doesn't mean that your intoxication is going to prevent you from having a head injury or from preventing you from having a stroke happen. You can still have a head injury and be intoxicated, or you can have slurred speech, troubles with your balance, and makes it look like you're intoxicated when you're not. So kind of roundabout there. It can look like sleep disorders, because concussion can cause sleep disorders. And if you haven't attributed it to your head injury, you might just think that that's your problem. You might not realize that it was the concussion that was underlying the sleep disorder. CSF leak. CSF is our cerebrospinal fluid. And you can actually end up with a CSF leak with some head injuries, meaning that there was a disruption in the system that controls your CSF in your brain. So that cerebrospinal fluid is created in the center of the brain. It lubricates your whole brain. It lubricates your whole spinal column. The only way we can test that is by doing a spinal tap, a lumbar puncture. So I have seen patients end up getting a spinal tap because their providers thought they had a CSF leak, not realizing that those symptoms really sound like post-concussive symptoms. So unnecessary and really invasive procedure for post-concussive symptoms. So again, a misdiagnosis there. Benign positional vertigo can look like that. So if you suddenly have episodes of vertigo, that might seem like just an off thing by itself, but it, again, could be because of that underlying concussion. But if you're not attributing it to the concussion, you're not going to get diagnosed appropriately with it. Dehydration, medication side effects, and sinus issues all could be mistaken for those symptoms that are actually related to concussion. But again, if not attributed to the accident or injury, You're not really going to think that that's what it is. So how do we tell the difference between this huge list of potential mimics and an actual concussion? This is where our medical training comes into play. So in medical training, whether it's physician or advanced practice provider, we learn that somewhere around 90% of your exam on the patient is getting a thorough history. When you do a physical exam, that should help clarify what we call our differential diagnosis. What is a differential diagnosis, you might say, for those of you not in medicine? It is essentially brainstorming all of the things that could look like what your patient is presenting with. Why do we do that? Because when you hear hoofbeats, you don't know if it's a horse, a donkey, a zebra, antelope, caribou, or a deer, or any other hoofed animal for that matter. You have to come up with a list of what it could be, and then you order tests to confirm or knock things off the list to help you come up with your final diagnosis. There are times when you're 99% sure you know what it is right away, but it's still important to rule out other things before settling on a diagnosis because you don't want to, quote, be sure of a diagnosis only to find out that you called a zebra a horse, meaning you missed that diagnosis, you misdiagnosed it. As I've gone through histories with patients and clients lately, we have talked about the onset of their symptoms, meaning when did the symptoms start? If someone recently got diagnosed with ADHD, for example, have you always had those symptoms or are they new? If they're new, when did they start? Was this before or after that accident that you told me about? Did you lose consciousness in that accident? Did you have any other symptoms that started after you were in that accident? These are the line of questions that I would give these people to see when did their symptoms start? Could it potentially be related to that injury that you have? Or is this something that's been around for a while and the injury has no effect on it? I have literally had patients that had fairly massive ATV accidents that they didn't think they had concussions from until after we talked more about it, talked about when their symptoms started. And oh, yeah, I did have a helmet on that cracked because I landed on my head. I'm just going to let that sink in for a moment. Helmet cracked, landed on my head, but I don't think I had a concussion. If you hit your head or you had some sort of event that caused your head to be jostled around, even if you didn't actually hit your head, and then you develop symptoms, there's a good chance you had a concussion and just didn't realize it. So what happens if we have a concussion and it goes undiagnosed or it got misdiagnosed? It can actually lead to persistent post-concussive symptoms, which can cause problems later in many areas of life. Headaches and cognitive difficulties are the most common persistent symptoms that tend to be reported, but it can cause learning disabilities. It can cause physical limitations if you have balance problems. So many things that can cause problems if you're not realizing that it's related to that concussion and you're not getting treated appropriately. So what if you realize that you had a concussion months or even years after the concussion occurred, the TBI occurred? I will tell you that it is never too late to try to repair some of that damage. There are many supplements that are good for brain health that can be helpful at any point in recovery. Just a couple would include omega-3 fatty acids and the B vitamins, also very good for your brain health. And there are still treatments that can be helpful, such as some of the things that I have been doing and learning more about: photobiomodulation, transcranial laser therapy, neurofeedback, vagus nerve stimulation. And even a new one that I'm still learning about is TMS, transcranial magnetic stimulation, still beneficial even after a period of time has gone by when you didn't realize that you have this concussion and now you know, or you still have symptoms years later. Any of these modalities will be maximally effective if you start them early on. But again, I've still seen benefit even when a couple of years has gone by since the injury. First steps you need to do would be to find a provider who will hear your case. And I've realized this is somewhat of a difficult task sometimes. It's hard to find a provider who will think big picture and still be able to identify what's going on and really take into consideration your full history, which means you have to provide them all of that history, including any of those accidents that you think might be trivial, but they might actually be related. PM&R, meaning physical medicine and rehab doctor, is a good mainstream medical place to start because they treat people who have these conditions on a regular basis. So they might be able to recognize that a little bit more readily than somebody who doesn't treat them on a regular basis. If you can find a concussion provider in a neurology clinic or a TBI clinic, that's also a great place to go. The caveat I will say with that is that not all neurologists are created equal. Some have more experience than others with this, but they still may not be experts. Most neurologists have a niche practice. They are really good at their niche. They are okay in other areas. So look for someone who specializes in head injuries or concussions. Functional neurology would also be a good place to look outside of that mainstream medical. It's not going to be covered by insurance most of the time, but it's still a great place to go, and they tend to be a little bit more open-minded as well. If you can travel and have the funds, there are several really good TBI programs across the country here in the United States, and there are several up-and-coming online neurology clinics that will improve access for concussion patients as well. Some of them are still in the early phases of creation, so they'll be more available in 2025, but they are coming. So the future of concussion care will be better than it currently is. Until then, keep looking for other opinions if you're not getting the answers you feel like you need. Second opinions and sometimes third opinions are sometimes needed in order to get you the answers that you need so that you can get the care that you need to help you get better. As with the ABCs of Concussion series that I have started, I share this information because somewhere out there, someone needs to hear this information. And I'm on a mission to improve care for others like me, one episode at a time, one client, one patient at a time. So I do, again, appreciate your help on this mission. If you could share this information, send it to somebody who you think might be in need of this information, whether it's somebody you think had a concussion or somebody you know had a concussion, or a provider that you know that needs a little bit more education on this as well. Because again, I'm on a mission to help educate everybody so that the care of TBI and concussion patients just gets better, because now that we know better, we should do better. So thanks, guys. Have a great rest of 2024. I will see you in 2025. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.